Meningitis is the inflammation of membranes surrounding the brain and the spinal cord. Meningitis is caused by many different viruses and bacteria. Symptoms of meningitis, which appear quickly, are often a high fever, a chronic severe headache, your neck becomes stiff, you continuously throw up, your behavior changes, becomes weird, you become confused and sleepy, you have a hard time waking up. All of these are symptoms of meningitis, and they're very important. In babies, symptoms aren't so specific for meningitis. Sometimes the child will be irritable or tired, they just won't want to eat, or they'll have a high fever. For some people, meningitis can be very dangerous and show up very quickly. If you have any of these symptoms, you should go see a doctor immediately. Meningitis is diagnosed by when the symptoms show up. Doctors will do a bunch of tests, ask you about your history, and then come up with an answer if it is meningitis or not. They'll look at your brain and your spinal cord. They'll see if there's any inflammation. You'll do specific tests to help determine if it is meningitis or not. The tests are all individual evaluations. If you have meningitis, they'll do blood work and look for signs of infection or bacteria. They'll do brain scanning and then a spinal fluid analysis. The most common way they do the test is through lumbar puncture. In a specific part of your back, they'll take a needle and they'll shove it into the bony part and they'll extract the fluid. The doctors will then look and analyze the fluid, at the cerebral fluid. The doctors will then, after they're done looking at the spinal fluid and deciding if it is meningitis or not, they'll decide what the best treatment is if they come up with a definite treatment or a definite answer of the diagnosis. They'll come up with the appropriate choice of antibiotics. If you do have meningitis, how can you treat it? You can, the doctors will give you some kind of antibiotic or an antiviral medication after they diagnose you urgently. They'll give it to you. In some situations, they'll give you some medicine to help prevent seizures. Sometimes medicines to reduce the brain swelling, inflammation. Medicines to help you relax, a sedative or something to help you sleep. Sometimes they'll give you medicine to help reduce your fever or headache, pain. Depending on what kind of meningitis you have, you might have to stay at the hospital. If it's serious, you'll probably have to stay. The prognosis for meningitis varies. It depends on the patient. Sometimes it's very mild, pain-free. And then sometimes the patient is very, very sick and it's very serious. Meningitis can make your body not function properly and you could die. Meningitis can cause damage to your nervous system. Also, there's neurological symptoms that may take many months for full recovery. And some patients will never fully recover. Viral meningitis can be self-limiting in 10 days or less, although sometimes it progresses so rapidly that within the first 48 hours, even despite treatment, the patient could die. Some forms of meningitis are contagious. The bacteria spreads through exchange of the respiratory and throat secretions. For example, coughing, kissing. Meningitis bacteria does not spread like, the same conditions as a common cold or flu. You can't be breathing the same air from someone and get sick from meningitis. It requires a lot more than that. People who live with a person who has meningitis, or anyone who's in direct contact with the patient, such as a boyfriend or a girlfriend, they would be considered high risk for acquiring the infection. People who are close contacts should receive some kind of test or antibiotics to help prevent them from getting the disease.